Assalamu alaikum guys. Today I am bringing you the tumor necrosis factor alpha inhibitors. So we are going to cut right to the chase, and we're going to skip all the basics that are written in the rules, and we are going straight to the guidelines that are going to help us in the exam. And the things that you study in the groups, and I have added on my groups. I'm going to show you these things. You don't have to read them right now, because I'm going to move forward very fast, and but I'm going to leave this PDF with you guys so that you can read it later and memorize it. Ignore these memes. We are moving forward. So we're gonna get the Netflix subscription in the $5 that we are going to pay for it at 0 to 6 8 weeks. Memorize it in your mind: 0 to 6 8 weeks. The Netflix is infliximab, by the way, and we are going to get the IV channels, that is intravenous route, and 100% tax free. We are gonna get these channels. So 100% is the bioavailability, I presume. And the next drug that we are going to discuss is etanercept. So we are gonna buy this ETOS book in the 50 rupees, but we're gonna have to pay 50 rupees per week. So only 76% discount we are gonna get. So 76% discount, that is the bioavailability basically. And the third one is Ada. Hi, Ada, ATMG, Ada, 40 every other week. Just remember this song and you're golden. So we are going to discuss about the adverse effects. If you cannot read my writing, then you can just text me whatever you. I've tried to write very openly, but I think it's still the ends feet. So first of all, the most common infection are the most common adverse effects are the injection site reactions. That it would be infusion reactions in case of infliximab. The other drugs, that the adalimumab, the golimumab, the etanercept, the certolizumab, they are all subcutaneous. So first is injection site reactions, reactivation of tuberculosis, heart failure, demyelinating disorder, new onset psoriasis, sarcoidosis, pancytopenias. The reactivation of TB, yearly testing for the latent TB in the high risk group. What is high risk group? In contact with TB, family history, family member with TB. Sorry. The test we're going to perform is TST, that is PPD, purified protein derivative with tuberculosis. So T-spot test we are going to do, quantiferon gold test we are going to do. Quantiferon is nothing but IGRA. Okay. The next is pregnancy and contraindications, the relative contraindications and absolute contraindication. You can read them later. Just I'm going to move on to how we are going to reinitiate the treatment if we ever stopped it. So we are going to give the loading dose again if 3 to 4 half-lives of the drug have been passed since the last dose. Okay, so it is safe in pregnancy and during lactation. Despite what is written in the rules, it is safe. Okay, the child that has to be immunosuppressed for 1 to 3 months. Okay, because this suppresses the immunity of a child, of course. And transplacental transfer of the drug in the 3rd trimester occurs. So there is a little chance of the adverse effects to in the child, but it is overall safety has been ensured. But to be on the safer side, we give to the certolizumab picol, because that will not cross the placenta. Its antibodies will not cross the placenta. So that covers one MCQ, I think. The next is vaccine and TB screening in pregnancy. The TB screening in pregnancy we are going to do at 0, and every 3 months we are going to perform IGRA. we have to avoid BCG to neonates for 6 months. Okay, we are going to give neonates that will not be neonate after 6 months. So we are going to give BCG to an infant, 6 months old infant. According to vaccine, we are going to stop the vaccine 2 to 3 half-lives per 4 weeks before until 1 to 2 weeks after. Same goes for the surgery and TNF alpha khichdi. So the TNF alpha can be continued in the surgery if it doesn't involve entering respiratory tract, GI tract, and genitourinary tract. So otherwise you have to stop it. That will again be 3 to 4 half-lives before and 1 to 2 weeks after the surgery. Again, it covers an MCQ. The drugs I have taken it from the study PRN. So if you calculate 3 to 4 half-lives, that will be equal to these things which I have written. Leternercept 2 weeks before, adalimumab 6 to 8 weeks before, infliximab 4 to 6 weeks before, ustekinumab 12 weeks before. So we are going to come to the boring thing, that is the anti-drug antibodies. Just read these highlighted things and you're golden, and nothing else you have to worry about. Okay, so that will conclude my presentation. And so if you got bored, I am sorry. Thank you. That is thank you. In case you didn't read. Allah Hafiz.